Bob Schwanke is a retired associate professor at the University of Minnesota School of Public Health. He began his career in public health in 1955 following his service in the U.S. Army. He began as a health education specialist with the Minnesota Department of Health, and then served as director of education in the Sister Elizabeth Kenny Institute and American Rehabilitation Foundation. Bob then joined the Minnesota Society for Crippled Children and Adults, now known as Courage Center, to launch a 5-year statewide program to improve accessibility for the disabled.
I had my undergraduate work here at the university in economics, business administration, and journalism. And I was going to go into public relations advertising, which I did when I got out of the Army for a very short time, about 3 months. And I didn't like the ethics.
Directing the Architectural Barriers Education and Research Project, he guided the process to secure adoption of a law by the Minnesota Legislature in 1963.
The law was to require that all public buildings in the state of Minnesota meet accessibility standards, the American Standards Association.
In 1966, Bob joined the School of Public Health as an assistant professor and an assistant dean, a relationship that would extend into over 25 years of dedicated service. He introduced numerous curriculum and course innovations, serving as director of interdisciplinary studies, alcohol and other drug counseling, and the Joint Public Health Social Work degree program. He also designed courses tailored to student needs in their practice areas.
I think the interdisciplinary studies program was probably one of the most important thing that I was able to put through.
Throughout his career, Bob has stayed active, volunteering with the Minnesota Public Health Association, serving as its president from 1969 to 1970, and on numerous boards and advisory committees of community and state and local governments. Under Bob's leadership, MPHA drafted legislation that would encourage minors to seek needed help and enable professionals to provide services on a confidential basis. The Minors Consent to Health Services Act of 1971 became a model statute across the country. Since retiring from the School of Public Health in 1992, Bob has kept busy with ongoing volunteer activities with MPHA and St. Mary's Episcopal Church, serving as a consultant with various local and state organizations and mentoring public health professionals. He and his wife Phyllis live in St. Paul.
I used to say this to my students when they'd come in anguishing because they didn't have their whole life mapped out. Life unfolds. You can't predict it. You got to be ready to move with your values and what you think is right.